Have you ever wondered what fentanyl is and why it's become a topic of such intense discussion? This potent opioid medication has been making headlines, and not always for the right reasons. Originating in the medical field as a powerful tool for managing severe pain, fentanyl has a dual nature. On one hand, it's a marvel of modern medicine, providing relief in situations where other painkillers fall short. Its rapid onset and potent effects have made it a critical tool in surgeries and for patients dealing with chronic pain. Yet, there's another side to fentanyl that's stirred controversy. Its potency can lead to misuse, and the risk of addiction is a serious concern. These factors have cast fentanyl into the spotlight, sparking debates among healthcare professionals and the general public alike. The conversation around fentanyl is complex, but understanding this powerful drug is vital. Stay tuned as we delve deeper into the world of fentanyl, unraveling its uses, pros, cons, and long-term effects. Fentanyl is not just a name you hear in the news. It plays a crucial role in the medical field. In the realm of medicine, fentanyl is a potent ally in the battle against pain. It is an opioid, part of a class of medications that bind to opioid receptors in the brain, blocking pain signals and providing relief. Fentanyl is particularly strong, estimated to be about 50 to 100 times more potent than morphine. Imagine a scale of pain from 1 to 10, with 10 being the most unbearable pain you can conceive. Now imagine a medication that could dial that 10 down to a manageable level. That's the power fentanyl possesses. But where is this potent pain reliever most commonly utilized? One of the primary areas is in surgical procedures. Anesthesiologists often use fentanyl as part of the cocktail of drugs administered during surgery. It helps to render patients unconscious and pain-free during the procedure. It's also used post-surgery to manage the acute pain that patients often experience after coming out of the operating room. Yet the use of fentanyl isn't just limited to surgical settings, it's also a crucial tool in the management of chronic pain. Patients suffering from conditions that cause persistent long-term pain, like cancer, may be prescribed fentanyl patches. These patches allow for a slow, steady release of the medication, providing long-lasting relief. In hospice care settings, fentanyl is also used to provide comfort and pain relief for terminally ill patients. It's a medication that allows these patients to spend their final days with as little physical discomfort as possible. However, it's important to remember that fentanyl is a tool, and like all tools, its effectiveness lies in its proper use. It's a medication that should only be prescribed and administered under the careful supervision of a trained healthcare professional. Misuse can lead to serious consequences, including addiction and overdose. However, like any potent medication, fentanyl comes with its own set of benefits and risks. So, what makes fentanyl a valuable tool in pain management? Let's dive into the benefits of this potent opioid. First and foremost, fentanyl is renowned for its extraordinary potency and pain relief. It's about 100 times stronger than morphine, making it a crucial resource for managing severe pain, particularly in cases where other painkillers fall short. Another noteworthy advantage of fentanyl is its rapid onset of action. Unlike other pain medications that might take a while to kick in, fentanyl starts working in just a matter of minutes. This swift action can be a game changer for patients in acute pain, providing them with the much-needed relief almost instantly. Moreover, fentanyl's effectiveness isn't short-lived. It provides sustained pain relief, making it suitable for managing chronic pain conditions as well. While these benefits make fentanyl a powerful painkiller, they also contribute to its potential for misuse. As we move forward, we'll delve into the potential drawbacks and risks associated with fentanyl use. It's a double-edged sword, and understanding both edges is crucial. Scene script. Despite its benefits, fentanyl carries significant risks. Let's delve into the potential drawbacks of this potent opioid medication. Fentanyl, whilst effective in managing severe pain, can also contribute to adverse health conditions. Among the most concerning is the risk of addiction. This stems from the drug's ability to produce feelings of extreme euphoria, leading some individuals to misuse it in pursuit of this high. Over time, the body becomes accustomed to the drug, requiring higher doses to achieve the same effect, a slippery slope indeed into the depths of dependency. Another serious concern is respiratory depression. This is a condition where breathing becomes dangerously slow or even stops altogether. Fentanyl, being a potent opioid, can drastically slow the body's breathing rate, This is particularly dangerous when the drug is misused or taken in higher than prescribed doses, potentially leading to a fatal overdose. It's not just misuse that's a problem, though. Even when used as directed, fentanyl can cause a host of unpleasant side effects, including nausea, constipation, and confusion. Long-term use can lead to physical dependence and withdrawal symptoms if the drug is abruptly stopped. These can include restlessness, muscle and bone pain, insomnia, and severe flu-like symptoms. Moreover, fentanyl has a high potential for fatal overdose due to its potency. It's estimated to be 50 to 100 times more potent than morphine. A tiny amount can be enough to cause an overdose, especially in individuals with no opioid tolerance. This is why illicit use of fentanyl, often mixed unknowingly with other drugs, has been linked to a significant number of overdose deaths. Lastly, it's important to note that fentanyl can interact dangerously with other medications, including certain antibiotics, antifungals, and heart medications. These interactions can increase the risk of serious side effects, including life-threatening breathing problems. Understanding these risks is crucial for anyone considering or currently using fentanyl. It's a stark reminder that powerful medications like fentanyl should always be used responsibly under the supervision of a healthcare professional and never beyond the prescribed dosage. Scene script with fentanyl, like any drug, can have side effects, both short-term and long-term. To begin with, let's discuss the immediate or short-term side effects. Upon administration of fentanyl, some individuals might experience nausea, vomiting, constipation, or lightheadedness. Some may also experience drowsiness, dry mouth, or even a feeling of extreme happiness or sadness. These effects are typically temporary and may diminish as your body adjusts to the medication. However, there are also more severe side effects that could occur. These include slow or shallow breathing, fainting, seizures, and severe drowsiness that can lead to difficulty waking up. If any of these are experienced, it's important to seek immediate medical attention. It's worth noting that these severe side effects are more likely if fentanyl is used improperly or without medical supervision. Now, let's move on to the potential long-term side effects. Regular use of fentanyl, especially if misused, can lead to a physical dependence or addiction. This means that the body becomes so accustomed to the drug that it requires it to function normally. If the drug is then suddenly stopped, withdrawal symptoms such as restlessness, watering eyes, runny nose, nausea, sweating, and muscle aches may occur. Moreover, long-term use can also lead to an increased tolerance to the drug. This means that over time, higher doses are needed to achieve the same level of pain relief, increasing the risk of overdose. Another critical long-term effect is the potential for serious harm to mental health. This could manifest as mood swings, anxiety, depression, and even hallucinations. Lastly, it's important to note the risk of a fatal overdose. Fentanyl is incredibly potent, up to 50 times stronger than heroin, and a dose as small as 2 milligrams can be lethal. This risk is significantly heightened when fentanyl is used recreationally or mixed with other substances, particularly alcohol or other opioids. These side effects underscore the importance of using fentanyl responsibly and under medical supervision. It's crucial to remember fentanyl is a powerful tool when used correctly, but it should never be taken lightly. Always consult with a healthcare professional for personalized advice and guidance. Certain factors can increase the likelihood of adverse effects or abuse of fentanyl. Let's delve into some of the risk factors associated with fentanyl misuse. A history of substance abuse is a significant factor. Those who have struggled with drug or alcohol addiction in the past are more prone to misuse fentanyl, given its strong opioid nature. Mental health conditions such as depression or anxiety can also contribute to misuse. It's not uncommon for individuals battling these conditions to seek relief in potent substances like fentanyl. Thirdly, prolonged exposure to the drug can lead to tolerance, prompting the user to take higher doses for the same effect. This can quickly lead to dependence and potential overdose. Lastly, easy access to the drug, whether through prescriptions or illicit sources, is a major risk factor for misuse and addiction. Being aware of these risk factors is an important step in preventing misuse and addiction. Unfortunately, fentanyl has a high potential for addiction and dependency. This potent opioid can create a physical and psychological reliance that is difficult to break. But what does this really mean? Let's start by understanding addiction. It's a chronic disease characterized by drug seeking and use that is compulsive, difficult to control, despite harmful consequences. With fentanyl, as with other opioids, the brain's reward system is hijacked, creating a powerful urge to use the drug again. To complicate matters, fentanyl is incredibly potent, up to 100 times more powerful than morphine. This potency can lead to a rapid onset of addiction, sometimes after just a few uses. The brain quickly becomes accustomed to the euphoria and pain relief the drug provides, making it hard to stop. Now, let's talk about dependency. Dependency is a physical condition where the body adapts to the drug, requiring more of it to achieve the same effects and experiencing withdrawal symptoms when the drug is abruptly stopped or reduced. Symptoms can include restlessness, muscle and bone pain, insomnia, diarrhea, vomiting, and severe cravings. Withdrawal from fentanyl, like other opioids, can be excruciatingly painful and difficult to manage, but it's not typically life-threatening. However, it can feel life-threatening to those going through it, which often leads to relapse. Signs of fentanyl addiction can include intense cravings for the drug, inability to control or stop use, persistent use despite negative consequences, neglecting responsibilities, and withdrawal symptoms when trying to quit. It's important to remember that addiction and dependency can happen to anyone, regardless of age, socioeconomic status, or background. It's not a sign of weakness or a character flaw. It's a serious medical condition that requires professional help. This is why it's critical to use fentanyl responsibly and to seek help immediately if you suspect addiction. Remember, there's no shame in reaching out for help. Recovery is possible, and there are many resources available to support those struggling with addiction. Proper use of fentanyl can help manage pain effectively while minimizing risks. Yes, you heard it right. Fentanyl, like any other potent medication, should be used responsibly to maximize its benefits and minimize potential harm. The first step towards responsible use is adhering to the prescribed dosage. Fentanyl is a potent opioid, and even a tiny deviation from the prescribed dose can lead to severe consequences. So never adjust your dosage without consulting your healthcare provider. Regular checkups are also crucial when using fentanyl. These visits allow your healthcare provider to monitor your progress, adjust your dosage if needed, and keep an eye out for any signs of dependency or adverse effects. It's not just about popping in for a quick prescription refill, it's about ensuring your health and safety. Open communication with your healthcare provider is another vital aspect of responsible fentanyl use. Don't hesitate to raise any concerns or discuss any side effects you're experiencing. Remember that your healthcare provider is there to help you manage your pain, not to judge you. So, if you're experiencing any side effects or if you're worried about dependency, speak up. It's better to address these issues sooner rather than later. Additionally, never share your medication with others. Fentanyl's potency can be deadly to someone not accustomed to such a strong opioid. What works for you may not work for someone else, and it could even be harmful. Finally, store your medication safely. Keep it out of reach of children and pets and away from anyone who might misuse it. And when it's time to dispose of any unused fentanyl, don't just throw it in the bin or flush it down the toilet. Consult your pharmacist or local waste disposal facility about safe disposal methods. To sum up, responsible use of fentanyl involves adhering to your prescribed dosage, attending regular checkups, maintaining open communication with your healthcare provider, and ensuring safe storage and disposal. It's a commitment to your well-being and to the well-being of those around you. Remember, responsible use is key when it comes to fentanyl. Let's bear in mind that with great potency comes great responsibility. Fentanyl isn't the only option for managing pain. Indeed, there are many alternatives that patients and healthcare professionals alike can consider. For instance, non-opioid medications such as NSAIDs or acetaminophen can be effective for mild to moderate pain. Physical therapy and behavioral interventions can also play a significant role in managing chronic pain conditions. In more severe cases, other opioid medications may be considered, but they come with their own set of risks and benefits. It's crucial to remember that every individual is unique, and what works best for one person may not work for another. That's why it's so important to have open, honest conversations with your healthcare provider about your pain, your concerns, and your overall health. This dialogue can help guide the decision-making process, ensuring that you're receiving the most effective, safe, and appropriate treatment for your unique situation. Always consult with your healthcare provider to find the best pain management strategy for your individual needs. Fentanyl is a powerful tool in pain management, but it's not without its risks. We've unpacked the world of this potent opioid, discussing its uses, benefits, drawbacks, and potential dangers. It's clear that fentanyl can be highly effective in managing pain, particularly in surgical settings and for chronic pain sufferers. But its potency and rapid onset of action, while beneficial, also come with significant risks. The potential for addiction, respiratory depression, and other side effects are serious considerations. Understanding the risk factors and being aware of the signs of dependency can help in mitigating these risks. The importance of responsible use under proper medical supervision cannot be overstated. It's also vital to consider alternative pain management options, keeping in mind that fentanyl is just one tool in the toolbox. Remember, knowledge is power. Stay informed, stay safe, and thank you for watching.